morning. This is the July 14th Nursing Home and VAC Committee meeting. I'm Kathy Bright, Committee Chairman, and we'll take attendance. Kathy Owens. Here. Doug Stockley.
Here.
Matt Slager.
Here.
Ron Blue.
Here.
Bill Brown. Here. Nancy, you're here. Okay, everybody's here. We'd like to call the meeting to order. We can't have any remote attendance because we're all here. Let's see, can we have a motion to approve prior committee minutes? Kathy and Nancy second. All in favor? Aye. Okay, motion passed. Capital asset review. No, we don't have that. Okay. So Krista is not here from the VAC, so we're going to go straight to Kathy with the nursing home.
All righty. Good morning, everybody.
Sorry, hang on, Kathy. Yeah, has everybody had a chance to review the bills now? Okay, yeah, we're going to put that off till everybody sees them. And now we'll come back to you, Kathy.
Okay, thank you. Yes, I have bills.
We have bills too, yeah. A few.
All right, I'm going to go ahead and just recap the finance department that I read last month, only for the people that were not here, so they can possibly have a clearer understanding of things. So in the finance department, following was the June's financial report. Current daily room rates are $242 daily per private room, $238 daily per expanded care, $230 daily per semi-private. Census at the moment is now at 62, leaving an average potential of income of $420,900 in a 30-day month, assuming every resident and/or insurance pays in a timely manner. Medicare A payments are for the skilled resident. Skilled residents are those who come directly from a 3-day hospital stay and qualify for therapy, as well as having qualifying diagnoses. Medicare B payments only pay for therapy for residents who are not completing a skilled stay. Medicaid, MMAI, managed care payers reimburse the nursing home for room and board for those residents who qualify. MMAI, Illinois Medicare-Medicaid Alignment, is a program that combines dual eligible individuals in Illinois. It aims to integrate care and streamline healthcare delivery by providing a single Medicaid-Medicare MMP for those beneficiaries. Managed care insurance refers to health insurance plans that have contracts with a network of healthcare providers and facilities. These plans are designed to manage the cost of quality of care delivered to members, which include provider network, cost control, care management, and reduced out-of-pocket costs. All insurances as well as hospice payments may vary month to month. Some are currently reimbursing us for claims from February and March, while others are more current. This can cause a fluctuation in monthly revenue. Residents who come to the facility and apply for Medicaid initially are not paying their liability portion until this is approved or denied. Most are processed in a timely manner, while other more in-depth financial situations can take up to 2 to 3 months to fully process. This can also lead to a fluctuation in revenue. QIP payments are quality insurance payments issued to each facility by all our Medicaid payers. This is determined based off our monthly bed assessment and our nursing home scores with Medicaid, as well as by our yearly cost report, which was just recently completed. QIP payments are not consistent monthly payments. Provider participation fee is a monthly Medicaid bed tax. This fee is calculated based off our census each month. This month, 2 were paid, which would have been last month. One was for the month of January, and the other was for the month of February. Depending on when the monthly bed report is completed, the monthly bed report, some months reflect 2 payments, while others may not have any. Regardless, 1 check is issued for each month. In the month of April, our outstanding auditing company, Mack & Associates, made a transfer of $685,574 from our account as an adjustment. When clarifying, it was stated that on 11/30/23, the nursing home was credited for this amount, and in turn, they debited it as a correction and backdated the adjustment to 12/1/24. Moving on to current activity department, June came and went quick.
Does that mean that we had money in there and they took it back?
Correct. Activity department, June came and went quickly for the residents. We enjoyed memorable stories from Bill Myers. We were proud to honor our men with special Bianchi's pizza party in celebration of Father's Day. We hosted a picnic for both staff and residents, generously sponsored by a donation from a resident family that had passed. We had entertainment and a balloon artist that was enjoyed by all. We had amazing family participation, which made the day feel like a true community celebration. We are continuing with our grief groups, Friendship House Bingo, and in the process of interviewing new hires for the activity department as aides. We will be hosting our annual garage sale in September and are currently taking donations of gently used items in good condition. Admissions, current census is at 61, new admissions is 5, discharges was 4 for last month, current projected admits for July will be 3. Community outreach and marketing visits to promote the facility included visits to the Bridges Senior Center. There's a new Bridges director, Jessica Ortiz, working through alternatives for the older adult. They are providing more programming and activities to the Prue Senior Center location. Bridges recently had to cut employee work hours due to funding, and Mendota area senior services were also affected as well. A marked increase of referrals came from St. Joseph Acute Rehab through St. Joseph Hospital Joliet. We currently did intake from St. Joe's for a patient who wanted to come to LaSalle County to finish post-stroke rehab. Several families toured in June, and there are currently 3 projected admissions as a result of those tours. Community word of mouth is positive, and several families have come to tour based on the positive experience of other families. Employee incident report. There was 1 employee incident report for June. CNA reported that a combative resident punched her in the stomach and placed his hands around her neck. There is no injury reported. Total to date for 2025 is 5 employees and 0 visitors. Rehab and restorative report. The restorative department is continuing to develop new programs and activities for residents to improve their abilities to remain independent in their activities of daily living. Our garden continues to thrive, and we have made several salads for residents to enjoy. The tomatoes are starting to turn red, and we have peppers close to harvest. We are anticipating expanding the garden next year and make it more accessible to all residents. The restorative staff has learned a lot about planting, maintaining, and harvesting thanks to input from residents and their families. We have seen an increase in residents using the new step exercise bikes this month and are encouraging others to try them. We are inviting new residents to the morning groups that practice range of motion exercises and increase socialization with peers. June fall report indicated 5 falls for the month. This is down significantly from previous months. There were 2 falls with minor injuries that were treated in-house. Staff continues to be monitored for use of gait belts and reminded to use them for any resident needing assistance with transfers and ambulation. We received 2 new Hoyer lifts and 1 sit-to-stand mechanical lift this month to replace outdated equipment. We received a brief in-service from Easy Way on correct use of lifts and maintaining them. Our newest project is logging the wheelchairs and Broda chairs that are in-house and determining future needs. We are working on ordering new wheelchair cushions to replace older ones and for availability when new residents are admitted. Nursing department. The nursing home remains clear of any infectious disease outbreak at present. We continue to encourage our staff and visitors to continue with extensive hand hygiene practices and to monitor symptoms, and if having any symptoms, to not come to the facility to visit or work. The DON continues to interview for nurse and CNA positions. A PRN-RN has been hired and is finishing up her training. A part-time midnight CNA started, as well as a full-time day shift CNA and a part-time and full-time afternoon CNA. The DON continues to participate in webinars and Zoom meetings sponsored by Hospice, Omnicare, and Leading Age. They cover a wide variety of topics concerning long-term care. The DON will be attending a long-term care conference hosted by Leading Age this month. The DON also completed a CPR BLS class on 6/20/6/25 and will host another in August. Nursing department in-services are getting scheduled by department heads to ensure all mandatory and regulatory standards are met. DON will be conducting an in-service this month with staff nurses on MedPass survey prep, diversion, review of policy and procedure, and nurse consultant audit review. CNA competency audits have begun and will continue through the month of July. During these audits, the DON will shadow CNAs on all shifts to monitor job performance and checklists. Each review will then be discussed with each CNA individually, and if remediation is needed, an action plan will be put in place to complete immediately. Updates to the facility assessment are currently being addressed and will be presented to the interdisciplinary team by the end of July for review. The DON has completed psych audits this past month and will be training the RN liaison to assist in these audits for the next quarter. My report, the agenda pretty much covers everything I want to bring to the meeting. I also have attached multiple bar charts reflecting numbers from 2017 through 2024. I will not go over them as they are self-explanatory. If anyone has any further questions pertaining to the operations and sustainability of the nursing facility, please feel free to call and set up a time that works. Any of us will be happy to answer questions, and our finance officer, DON, and myself can answer any operational questions. We have hired a part-time resident transportation driver. I still need to meet with our consultant to establish psychosocial program, and a nursing home is designed to address the emotional, social, and spiritual well-being of residents, recognizing that quality of life extends beyond just their physical medical care and activity programs. Residents often face significant life changes, such as the loss of independent loved ones and familiar surroundings, which can lead to homelessness or loneliness, anxiety, depression, and other mental health challenges. I've reached out and started working on creating some programs to share with the consultant as my education, training, and certifications demonstrate the understanding of effectively meeting the needs of the psychosocial program. And that's all I got, other than what the agenda states.
Thank you, Kathy. Does
Yep.
anyone have any questions? Bill?
Can you explain to me, you said in 2003, they gave the nursing home,
23. I wouldn't go back to 2003. I've only gone back to 2017.
and so they gave the nursing home the 600-some thousand dollars.
Right, and through our outside auditors, they discovered that it was $685,574, and it was an account for an adjustment. And then, as it's so stated, the information we got is that it needed to be clarified. So then, in turn, they took it back and debited us the same amount in 12/1/24. I was not there yet. I was not there till May of 2024. That's the best I can tell you. I can't answer for anything
So
else.
They gave us the money, and then they found out it was not supposed to be
Sure.
given to us, so they took it back.
Human error, I would suppose.
But that don't really hurt our position financially.
It really doesn't. And the bar charts will show it. I purposely made visual charts for everybody to comprehend. And it covers everything, revenue, expenses through 2017 through 2024. It also covers other expenses, as in maintenance, as in utilities. It has our census, it has everything. That way, once everybody goes through it, takes a look at it, like I said, DON, finance officer, myself, we're open to questions, we're open to visits. So, just so everybody's fully aware. I don't know if we need to go down in line, or if I can have Carla speak now, or however you want to do this.
That should be fine, Kathy. I had just a couple of questions that
Sure.
are just technical little things, because as you know, we're not all that conversant in some of these things. So I don't really understand what quality insurance payments are. Can you just tell me a little bit about what that means?
That would be, I would rather have you talk with Brittany, our finance officer, and have her explain it in depth, so I do not explain it wrong. That's why the three of us work very closely together.
Okay,
So you can call her anytime.
okay. And is it the same with the provider participation fee?
Yep,
It's
she would be able to
something-
explain that in depth, because that's what she does.
Okay, okay, thank you.
No problem.
So yes, we can, does anybody else have any questions before we move on to that? Okay, go ahead, Kathy.
Wheelchairs and broad chairs?
That was just a typo on my part. It's Broda.
Rhoda, what is that?
A Broda chair? It's an elongated chair that it basically is safe, more so than a wheelchair. It's cushioned and it's longer, and so the back can be laid down with the resident in it, or it can be sat all the way up. It's just a little more protection than a wheelchair, and a little more stability than a wheelchair if someone needs it. So if they really can't, if they don't have the core strength to be in a wheelchair anymore, a Broda chair would be very sufficient for them.
Oh, okay, great.
And yes, it was a typo.
Oh, well, that's okay. I should know what this is.
I noticed it as soon as I was reading it, so yes. You
Okay,
called
thanks.
me out, Kathy. So,
Anybody else? Doug?
Yeah, last night I read through last month's report. Sorry I wasn't here for that meeting. And then I listened to your report today as you went through things. So the tax levy, I see that we've been running a deficit every month in over 100,000 a month, or around 100. Like this month, I just calculated 161,030. So the deficits have been adding up, and I think we're about half of our proposed tax levy. Is that tax levy, the amount I had was 1,757,517. Is that a hard and fast number?
that's going to be a Don question.
Should be the tax levy that,
It is.
yeah.
Okay. And in the previous month, you stated that we typically don't get anything from the tax levy for the first half of the year. Is that
We
correct?
did not get a tax levy payment until July this month.
Okay. So I didn't look, but did we, does it show up? No. It'll show up in this month's records. Okay. All right. So that answers that question. Let's see. On the equipment that was sold, or not sold, but replaced, what do you do with the old equipment?
Equipment as in what?
You mentioned this.
You mean like the wheelchairs?
No, Hoya lift,
Hoyers.
and so
Oh, okay.
what happens with the old ones?
The old Hoyers were outdated, and they will go in for scrap. Or if they can be returned to the manufacturer, but in this case, they were outdated. So they will go in for scrap. We have a
Okay.
Morton building full of old wheelchairs and
Okay.
whatnot.
That's what the garage sale's for.
Absolutely, yes. And we will take no responsibility for anyone buying one of those.
So they are really non-usable, or,
Absolutely. They only have so many years to them, and they have to stay within compliance of the maintenance, or else we cannot use them.
okay. I didn't wonder, I wondered if, like a family or something could purchase it and start using
No,
it at home.
no.
Okay, they're that outdated, okay.
Plus, it really wouldn't be safe. It would be like, you can't sell a used car seat, you can't sell a used stroller, you just can't.
Last month, I see that you mentioned wheelchair maintenance and cleaning program. Who does the maintenance on those wheelchairs?
Maintenance,
The
Our
maintenance
maintenance
department is
department.
able to do it.
absolutely.
Okay, good, good. And it's good that you're cleaning them on a monthly basis, a monthly basis?
We shoot for weekly.
Oh, okay, all right. And I see last month that you wanted to hire a resident transportation driver and a staffing coordinator.
We hired a part-time driver, and we will discuss today in further detail the other position.
Okay. Your aggressive residents, have you ever done a study on what proportion of them end up being male versus female?
No. There's no reason to. In all honesty, there's no reason to, because every single individual that comes into the facility to live there, regardless of what their medical and/or other issues are, cannot be diagnosed compared from female to male or vice versa. So in all honesty, that would not matter. We can't do that. I mean, as a side, hey, can you do that for me? Sure. But as an important function of the residents that we choose to come into the facility, no.
I was thinking along the line of training the CNAs to be more watchful for one versus the other.
You can have an 80-year-old cutest little button lady that will scratch your eyes out. Or you can have
Okay.
a male that, you know, is going to walk by and say something derogatory. It doesn't matter. It doesn't matter.
Having a mom in a nursing home recently, who's recently passed away, was known for actually
Exactly.
scratching people. So,
Yep.
but she would have never done that or thought of doing it
Right.
in the day. So,
So, yeah, no, we don't.
okay, thank you.
You're welcome.
That's all.
Okay. Anybody else have anything? So Kathy, you wanted to move on to the scheduler, is that what we're?
Well, we can touch base real quick on the medical director and the psychiatric contract with New Hope, only because I know that both Don and I received a message or an email back from Mark this morning. So I honestly just need to know where those stand.
Okay.
The medical director contract, they changed absolutely everything that was requested from us, and now I'm just waiting on approval so I can get that started.
Okay. I heard there might have been some changes made again. Is that-
Again?
I'm not sure. Don, do you know anything
it-
about that?
Excuse me, it was updated, and I just looked at Mark's email this morning, and basically there, one of the biggest issues was liability insurance, and they will be covering that.
Okay. So is that on the agreement or is it a change?
Yeah, it's on the new agreement.
Okay.
As
The
the-
agreement that we have in front of us, it's on that.
Pardon?
The one that we have printed out, it's on that.
Should be.
Okay. Okay. So does anybody have any questions on the medical director agreement?
Has the current medical director been notified?
No, I needed confirmation, which is what I'm hoping for today, so that I can move forward with what I need to do, absolutely.
How many days' notice to?
90. So if I get positive confirmation today, then yes, that will be something I will do.
So was everybody on the committee aware of this medical director change that we've been contemplating? I think so. Okay. And does anybody have any questions on the agreement? Yeah, go ahead, Bill.
Is this, guy you're talking about, are we talking about an individual here?
Medical director, yes.
Has he been our director before?
Previously, yes.
Like, just this past,
Is he currently our medical director? No. Was he previously? Yes.
okay, you feel like he knows what the hell he's doing?
Oh, absolutely, yes, 100%.
Yeah, but this is with a medical group, it's not with a doctor directly.
Excuse me, Don.
Go ahead, Mark.
Sorry to be creeping, but old habits and all, you know. Wanted to make sure, Kathy, Don, this has to go to the full board.
Yes.
Obviously, it's a sizable increase economically, so I would hold off until you receive full board approval, not just your committee approval, because that just, gets the ball rolling, but it still has to go in front of the full board. So until there is a definitive approval, I would not recommend notifying the current representative or doctor.
Okay, thank you, Mark.
Thanks, Mark.
Yep. I'll be hanging around if you need me.
Okay,
Good.
All right.
Thanks, Mark, and we'll have to
Yep.
change the date on this contract too for whenever it starts.
Yeah, well, I think it said April. I didn't mess with that or anything.
Yeah,
I
that's
can't
fine.
remember if it was this one or the other one, but I know that has to be adjusted.
Yeah,
Yes.
thank you.
Okay.
Okay. So if nobody has any questions, does somebody want to make a motion then to forward this to the full board? Bill? Anybody want to second it? Nancy? Thank you. All in favor? Do we need to get, because of it being the amount, do we need to get that roll call, or can we just?
I'm sorry, just forward it to the board.
Okay, so we're just forwarding to the board. All in favor?
Right.
Aye.
Okay, motion passed. So this will go to the next full board meeting for final approval.
Okay, good, thank you.
Okay.
All right, the next one is a contract that I had sent out. Both Carla and I have met with a new psychiatry group called New Hope. I want psychiatrist visits in-house. The current psychiatrist that we do have does it by remote only. And I'm just not a fan. I think more people will gain more support and understanding out of actually having them there. So we met, I met with them once, and then Carla and I met with them again, and I'm very, very happy with them. I'm happy with absolutely everything that they can bring to our residents. And so and it's no cost to us because they do all the billing. They would just be a welcoming source for our facility. So I did send the contract on to Mark and Don, and I just wanted approval of where I'm going with this before I contact them.
Okay, yeah, and I completely agree that in-person is far preferable.
It is.
Does anybody have any questions on this one? Kathy Owens?
So is it the same psychiatrist?
It is not. It will be a whole new group.
Okay.
And actually, this group, there's one individual now that does it by telehealth, and the ones that we would have coming in will have, they can be available every day if we need them. And they will bring in 1 or 2 a week if we need them. So the availability for the support to the residents is tenfold with this. And that's what we're looking for.
So they'll come once a month,
No, they'll come at least once a week.
once a week?
Absolutely,
Oh.
absolutely.
Is it a different one each week?
They're
or-
going to try not to until I actually have a solid approval of what I'm doing, and will I contact them, and then they will set it all up. And then the main psychiatrist with the group of New Hope, he's available to us 24/7, and he oversees absolutely everything. So it's nothing but a positive for the residents,
Okay.
honestly.
Sounds good. So this is a psychological group that focuses on nursing home patients? Okay.
Absolutely.
And how much does it cost?
It doesn't.
Oh.
Because they do their own billing. So they will come in, Medicare, Medicaid, private pay, it does not matter. But as we will give them a list of people that we feel will benefit from these services, and as more people do, probably more will then want to sign up. They do all the billing. There's no expense to us whatsoever, other than giving them the opportunity to come in and support these residents in their fashion.
So you'll have a room set aside for them? to
I'm
meet?
looking for one.
Like the conference
We'll
room?
figure it out. We will figure it out.
Okay, thank you.
Bill, did you have something?
Bill, can you turn on your mic, please? Thank you. You didn't last time, and I let it go.
Here, how's that?
Thank you.
Okay. You say these are psychiatrists?
Yes.
That come in?
Mhm.
And, we use them that often?
The one that we have now sees people once a month. To give the residents an opportunity to see someone more than once a month and to see someone in person will give them the stability of support and emotional direction with whatever they need and or want to talk about with a psychiatrist. Yes, absolutely.
And it don't cost us nothing?
No, it's all billed through them, through their insurances.
And, do they have a schedule that they come in to see people with?
We'll set it up with
Or does
them.
somebody come, if I'm a resident, do I request it?
Absolutely. We'll have it both ways. We already have a list of people that see the one that we have available now. So we will let them know if this goes forward, that we now have a new psychiatric group coming in that are actually going to see you, and do you still want to see them? With that, of course, obviously, they all talk to each other. I mean, there's 62 people doing this. So if those people that have already seen the other psychiatrists are happy with with this new group, then they will tell more people. There's a lot of people there that are just sad. We're not talking psychiatric support because they're mentally unstable. We're talking psychiatric support because they're sad, they're depressed, they're angry, they're everything. This just gives them that added support, emotional support.
And is this a contract, like an annual?
It is.
Is it, okay, so after a year, we could decide if we don't want them
Sure,
or choose somebody else?
sure, absolutely. Just like I'm doing now. Right now, there has been an established psychiatrist in the building that only does remote. I don't like remote.
Okay, I agree.
Okay.
So, Mark, since there's no monetary issue here, do we need to send this also to the full board? Or Don, whoever?
Yeah, I would think so. I had a question in that regard.
okay.
If the residents like who they have now, does
They'll
this
still be able to see them.
still be able to see the,
Absolutely, absolutely, yeah.
and they're currently billed
Yep.
outside of the
Yep,
nursing home?
yes,
Okay.
yep. They could even see both of them if their insurance covers it, is what it's gonna come down to.
Doug?
I know we're talking about individual residents and trying to diagnose needs, but oftentimes it's the medical power of attorney, which oftentimes includes family. What opportunities would the family have of being there when the psychiatrist or psychologist is present and meeting with them?
I will have to discuss that with them. What Carla and I have discussed are the benefits, what they have to offer. Going into more detail like that, I did not find sustainable at the moment until I knew if we were going to have them in. So I will ask them, absolutely.
But typically, we do invite families if they want to participate. Families are welcome. They are welcome now with telehealth if they want to. And I don't think this new company would feel any differently about that.
I don't think so
It's
either.
collaborative, so we're fine with that.
I just haven't asked them yet,
Yeah,
that's all.
that's why we schedule it. We always set it up ahead of time, and then that way if families are known to want to come, we just give them the date and time. That's how we've done it in the past.
Again, I'm just thinking back when Mom was in the nursing home and I was having to make decisions and I didn't really understand the drugs and
Sure.
I was having to try to communicate with my sister and is it the right choice? It's the wrong choice. So oftentimes it's the family member that's making the decision and not the resident directly. So appreciate that.
Absolutely.
Any other questions? So, I guess we have to do this the same as we did the medical director, then we will forward this to the full board if I can get a motion for that. Doug, and second by Kathy Owens. All in favor?
Aye.
Okay, so this too then will go to the next full board meeting for final approval.
Okay.
Sorry, go ahead.
I just wanted to go back to the medical director. Did you say the one we got now doesn't want to renew his contract?
No, I did not say that. There's a time allowance on the contract that I have to be able to send out a letter. It's my choice at this moment to change medical directors if I want, and for various reasons and cause, I have them.
Okay. Now, is this new medical director going to have different responsibilities or the same exact?
He's going to have the same, plus actually he'll follow through with more. Yes,
Okay.
which is one of the issues.
All right. Thank you.
You're welcome.
Because I know
It
these guys
does.
don't know that. Or would we have to? No. Okay. All right, I won't say anything. Sorry.
That's okay.
Okay. Are you good with that? Or answer on that? Are you good with the answer you got? Okay, okay. Okay, sorry. I'm
Yes,
sorry.
yes,
I
he
was
did.
distracted, okay.
All right, next on there is the biggest one. I'm just waiting on approval of the project agreement for the patio addition. We've already been through it. The numbers are out there. I sent it to Mark and Pat, and they've approved it, moved it forward, and now it's just sitting. I just need to know what's going on. I am not completing my budget for next year until I know.
Okay, so on the patio addition, I believe that has to be let out for contract for public bid.
It does, oh yeah, it's all set up, and the contract I got from the architect. Everything is spelled out. I just need approval
Okay,
from the nursing home committee, from the full board,
Yes.
before anything can get started.
right.
Or else it's, so, yeah, everything is, and I do believe I handed all that out, the architect contract out to you months ago, but I can do it again if necessary. But it's all spelled out. That's what the architect was there for, to make sure with the engineers, with the bidding, with absolutely everything that was necessary. And yes, financially, can we pull it off? Yes, we can.
So, and I know that we were there and you showed us what you wanted to do. Does everybody still have the bid, a copy of that, or do we, would we like to get that again? You
All right,
don't
I can send it out. I'll email it out to I've got the list of everybody's emails. I'll send it out to everybody. But yeah, I need to know, I cannot complete my budget without this. I can put it in, and in fact, I already did. I already know it's feasible. But I'm not gonna put it in to present it until I know if it's gonna go forward.
Okay. And yeah, we do know, once we approve it here on the committee level, it's got to go on to full board.
Okay,
So, go ahead, Bill.
Turn this on. Yeah.
just leave it on,
Is
Bill.
this, yeah. Is this something that we can vote on today? I mean, we've all been out there and seen it.
We have all been out there and seen it, yes. I think it's a matter of how do we feel about the estimates, I think.
Yep. Total estimate for the job is $225,000. And I already have it prepared in my new budget, but I'm not turning in my new budget until I know if it's been approved.
Okay. And that 225, that includes the interior room that's going to be
Includes
everything that
everything.
you talked to us about.
Absolutely.
Okay.
So can we take a vote on that today?
I think we can. Ron, what did you want to
Still gotta
ask?
go to the board, right? Full board. for
It still
approval.
has to go
Oh,
to the full board,
absolutely,
correct?
yeah.
Yes. Yes. What? Sorry.
Nothing. You guys do whatever you want. It doesn't need to go to the full board. All that you guys are approving is for her to go out for bid.
Right.
That's it.
Oh.
The bid goes to the full board.
Right.
I don't have mic, so yeah. The bid goes to the full board. So there's still a chance that you guys can open that bid in here and still
say
turn
no.
it back.
Okay.
So all you guys are approving is for her to go out for Kurt to go out
Okay.
for bid.
Thank you.
Thank you,
Appreciate
Amanda.
that. Okay, so did you guys get that or no? You did. Okay,
I was gonna
so-
ask her to repeat it, but
So we then need a motion for, thank you, Bill. And a second for it to go out to bid. And Nancy's going to second that. All in favor?
Oh, thank you. Okay, last month at a different meeting, the scheduler position was brought up, and there was a lot of misconcept, possibly, on a lot of people's ends. So Carla, which is our DON, is here to discuss both the scheduler position and her position, so that everybody gets a stronger grasp on why we need a scheduler. So take it away. Oh, microphone. I got it.
Sometimes.
I don't need one.
So if you don't know who I am, I'm Carla Hanlon. I'm the Director of Nursing at LaSalle County Nursing Home. I have been the Director of Nursing for going on, this will be my 6th year. I've been with the county for 17 years, a little over. Started as a CNA, got my LPN, and then just got my RN, and here we are. So before I start, I do have a little presentation on the staffing coordinator, and I'll kind of let you guys know what I do. It's really hard, I think, like most of us, to compile what you do on a daily basis into one little page, because it changes every single day, and there's things that will take me away from what I'm doing on that day and focus on something else, but I'll try to be concise, and then I'm open to answering any questions you may have, since I'm here. I may not know if I'll be here again, so now is your opportunity as the nursing home committee to ask me questions that you might have. Before I start, though, I did want to follow up. I was writing a couple questions down that you guys had presented to Kathy, that I kind of want to clear up a little bit. Maybe it'll help, later on certain questions. So as far as training goes with residents who are combative, obviously the majority of our residents that come to us are not, but in some circumstances, we have some residents who, because of their disease process, get very paranoid, very angry, and that can turn into aggression for sure. Our CNAs, nurses, actually every single person that works at the nursing home has to have dementia training, and that includes maintenance. So when a person is hired in our facility, they have to do 6 hours of dementia training. Most of that is done via Zooms and YouTube videos and little webinars we have recorded. And then after that 6-year higher training or 6-hour higher training, then they have to have 3 hours per year. So everybody in the building gets 3 hours of dementia behavior type training. So they are trained. Obviously, we're people. And when a resident is having what we would call maybe a psychotic episode where we're trying to calm them, it doesn't always go our way because, again, it's unpredictable. Safety is our number one concern. We want to make sure that the resident is safe, that other residents are safe, and that our staff is safe. So we try really hard to make sure that we're including families. Sometimes families will come in and assist in helping sit with the resident to calm them, or having them, maybe calling them on the phone to try to calm them down. Sometimes we do one-on-one, where we just have one CNA or one UA or one nurse who is with that resident trying to calm them down. But there is training that's done, and we do that every year to make sure that everybody knows what to do in those situations. The other question that was brought up in regarding psychiatry, so not every single resident sees a psychiatrist. When they come in, they are offered the option. We're very fortunate as a nursing home to have a psychiatrist that does this for us, because not every nursing home does that. We feel it's very important. We've been doing it for at least a decade that I know of with our current psychiatrist. And it's invaluable because he gives different insight than other doctors. And a lot of our primary care providers are like, ask a psychiatrist. They don't want to mess with that stuff, because when you're talking about certain psych meds, they really don't want to get involved. They'd rather have the psychiatrist look at it because they have a higher, obviously, expertise with that. So typically, any resident who is on a psych medication, which is an anti-anxiety, antidepressant, mood stabilizer, and antipsychotic, anybody on those meds really should be seen by psych at least every quarter. Some don't need to see them that often. If we're not making changes to their meds, then they may only be seen maybe once or twice a year. It just kind of depends on what the resident needs, and also to what the family's agreeable to. So that was just kind of following up, I think, to Bill's question about, do they see them every day? Do they see them once a week, once a month? Right now, we do once a month visits. We'll see what happens if we're able to go on with the new contract, how often we do it. But it's tailored basically to what the resident needs, and also what we need as far as follow-up for those psych meds. So hopefully that answered some of those questions a little bit. So on to staffing coordinator. Staffing coordinator, we started that position in 2019, which was right around a little bit before I took over as director of nursing, and kind of at the same time, actually, really. And the need came about because at the time, we had the ADON who was helping do that. And she was also, and let me clarify, ADON was really title only because she was also our infection preventionist and our room nurse. And we all know that when you're doing multiple jobs as one person, things are going to get missed. And in a nursing home, which I'm not sure if everybody's aware, nursing homes are the most regulated entity in this country. It is serious business. I mean, this is just one, I just brought for reference, this is one of the new codes that we have to fix for facility assessment. This is 11 pages, and this is just one, and there's hundreds of them that we have to tailor to our facility. We have to make sure we have a policy and procedure in place, making sure we're following it to the T, because they will ask for those. So when you're having people do multiple jobs, something's gonna get missed, something's gonna get left behind, an error is gonna be made, because we're all human, and we make errors anyway, but when you're doing multiple things at once, it's very difficult. The schedule has to be concise, it has to be presented for everybody. The whole nursing department depends on these schedules, obviously, to know when they're working. So it is a very complex task that really is kind of undervalued sometimes. People are like, oh, just give them the schedule. They can do the schedule. Just not how it works. It's very crucial to make sure that we're meeting organizational needs and make sure we're compliant. Obviously, I think, I don't know if you guys talked about staffing before, but there's a set number of staffing numbers we have to have every single day. And we are held to that. And if we don't meet those staffing numbers, then we get a deficiency. And then that affects our star rating. So it's all just kind of, tumbles into the next thing. So to make sure that we're meeting organizational goals, making sure that everybody knows what day they're working, how many hours they're working, if they got their vacation day approved, if they got their personal time approved, ensuring that we're compliant with staffing numbers, and then also preventing operational inefficiencies, which would be a deficiency for not having the correct amount of people on. So when any nurse doubles as a scheduler, it's an added burden, which happens sometimes. I've been doing the schedule. So our current staffing coordinator, who is retiring, I'm helping cover when she's not there. And it's taking sometimes up to 2 hours of my day as a director of nursing to get some of those schedule things figured out. Because the schedule is a living, breathing animal. It is constantly changing. There's always something. I walk in and look at the board, and there's always something going on that board. Yes, Bill?
I guess I'm either not up to par or confused or whatever. Are we looking to hire another person?
Yes, we are.
Okay, and do we have a person that's doing that job now other than her?
The one that has been doing it is retiring, and that is the issue.
And so we're just looking to replace a retired employee.
Right, she had done multiple tasks in her 33 years there. One of them was scheduling, the other one was driver. So we have hired a part-time driver. We have hired someone for her position, and it was decided that I wanted to separate those three. So it's been my decision. So yes, I want a separate person as a scheduler who will also be hired as like a receptionist scheduler kind of thing. So she will be set up front, and so she can do the schedule, she can answer phones, because it's still a business on one side. And so that's what I'm looking at. So clarification was necessary after a finance meeting last month, and so this is why I wanted it done today, so that everybody fully understands the time that it takes to make sure that we have coverage 24/7, because that nursing facility is their home. And we have to make sure that we've got coverage for each and every individual that's regulated every day. That's where I'm at.
And you said that she was also a driver,
Part-time? Mhm.
and we have since hired a part-time driver?
Correct. So she was psychosocial. She was psychosocial coordinator. She was our transport driver. and she did the schedule. But she also has a fascinating personality and took all those on through the years, as you can contest to, because I haven't been there that long when she did all this for 33 years.
And now,
I want it separated,
so the person is gonna be just a scheduler?
/ receptionist is where it's going to come down to. And with that position, from a previous position that was started last year, July, but we don't need it, I still have that salary in my budget from last year. And I do believe she was only paid maybe 2 times out of it. So it's not, again, it's not even a financial restraint. It's already there. I'm just creating a new position.
And you need us to approve it? Is that what this is all about?
You guys explain the second step, because it already had been. It had already been through you guys, which then caused us to be able to go to salary and labor. Salary and labor, it was shut down, so I'm doing it again with Carla here to explain why it is necessary to have a certain body, one person, as a scheduler in that position. So go ahead.
So I was just leading up to, as nurse managers, we also do sometimes cover the floor, which is sometimes has to happen if there's a call off or a nurse has to leave for an emergency. So again, it's showing how we're doing multiple things at one time, having people cover, because that's what we have to do. We have to run. We can't stop running because something happens with the schedule. So unfortunately, when that happens, and obviously you're going to have incomplete schedules, which is not going to make anybody happy, especially the staff. Unwanted overtime, inadequate staffing ratios, which again, we cannot do that. Patient care suffers when nurse managers are handling a schedule and administrative tasks together. According to a study that I found in CIN, which is Computers, Informatics, and Nursing, it's an academic journal by Lippincott, nursing management impacts care outcomes, needing as much time as possible to focus on tasks that improve resident care. And yet some nurse managers say they spend up to 49% of their work time on desk work, and I will attest to that that is true. I spend a lot of time on a lot of follow-up that doesn't have to do with auditing and focusing on the nursing home, which is my job, which is what I'm supposed to do. Furthermore, the critical importance of nursing scheduling is underscored by the need for advanced posting. We do a 4-week schedule. People want to know ahead of time, and usually we try to get it out about 2 to 3 weeks ahead of time. However, sometimes if you're juggling dual jobs and dual roles, that can become very busy, and it's hard to keep that momentum going and keeping those people informed and making sure that the schedule doesn't stay dormant. It changes all the time. Today I even had a schedule. I got a text message at 6 o'clock in the morning. So it's every single day that schedule is changing. Ensuring that timely schedule publication, that we owe that to our staff so that they can see what they're working and making sure that they have their time set. They do get the opportunity to put schedule requests in, which again is another job that lands on the staffing coordinator. And those are, those can be turned in every day up to 2 days before their shift. So they can do those last minute things. Our staff is able to do that. It's something written in there as a union member. They can use that time, and they have to turn it in, and they turn it into the appropriate person. Dedicated schedulers equipped with proper training and technology are pivotal in establishing strategic, cost-effective facility staffing processes. They can enhance operational efficiency and create a better work-life balance for the nurses and CNAs via a well-planned schedule, ultimately fostering a more sustainable and harmonious healthcare environment, which I want more than anything every day. I want that to happen every day. I need to spend my time on what matters, and staffing is a huge part of our facility, and I do spend a lot of time on that. I will also say that I was the staffing coordinator. That was not my title. I was an RN that was asked to do it for 5 years. So I know what this job is about. I know what it takes. And I'm telling you, it needs one person. It needs a dedicated person to handle that staffing coordinating. If it's not broke, don't fix it. We need that to make sure that all the other things are buttoned up on my end. So I need to spend my time on what matters, and a lot of that is basically making sure that I'm supporting my nursing staff and my administrator, and then all the managers that I work with in the IDT team. I wanted to kind of touch base on, it was brought up about how hospitals operate for their scheduling, and I will say, there are staffing coordinators that work in other hospitals. Also, a lot of times in other nursing homes, they have a staffing coordinator. So they have somebody that's dedicated to doing that. We should be treated no differently. We want to provide the same kind of quality care, and to do that, we have to have that. I know that at our local hospitals, they use a software program. They use API, which we don't use software programs. They also self-schedule. And it's not left up to the director of nursing to do that. It's usually the nurse managers. So it's important to realize this is an important role in a facility such as ours. They need to be able to handle the overall scheduling so that we can stay consistent and making sure we're meeting those regulations for our staffing numbers. Yes.
You say like in a hospital, they have a staffing program that they use? Is that something that our facility could use? I mean, would it be beneficial or not?
You know, we've talked with a couple different companies that have offered that. The main thing with ours is that we have staff that can utilize time. They earn time. They have pretty good benefits at county. So they get vacation time, they get personal time, sick time, comp time. It would be really hard. Somebody would still have to be doing that stuff because that's not in a computer, right? I think when people think about a schedule, they create a schedule that you're plopping it into a, Excel format, and you put everybody's dates on there and what weekends they're off and blah, 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 and that's it. That's, the first part. Somebody makes that schedule, but then it's the life after that schedule is out that the staffing coordinator really focuses on. And I think that would be hard to plug that in.
We don't need a program?
No, I was just bringing that up because it was a conversation about what other places do.
Okay.
And I think that's pretty much all I have. I think I've made myself clear on what I want. Yes.
So how many employees do you currently have?
In my department, nursing department?
Where the staffing,
I'm
person-
gonna say probably right around, and I'm gonna add in my contract nurses, because we have contract nurses that I have to make a schedule for. I would say probably right about 50. With CNAs, nurses, unit attendants, and then my contract nurses.
and how many hours does the current person spend on the staffing, setting up the staffing?
Time-wise in day?
Yeah,
I would say probably at least maybe 6.
6 hours a day on staff
Yes,
for 50
yes.
people.
Yeah, so we have to do, so it's not, like I said, just the schedule, it's taking in the call-offs, and then when somebody calls off in our department, we have to go down the mandation list. Per union, every
Right.
single person has to be offered
Right.
that overtime. So they have to stop what they're doing, call down the list, and then return that, if that person picks it up, great. If nobody wants it, then we mandate. Then we have to go around and mandate that person to cover for that shift. But then you also have to do the need book. So we have a book of overtime. So when we have holes in the schedule, the staffing coordinator has to take and create a book every month that they have to put all the needs in for those schedules. There's also a mandation log. The log has to be updated every single day with anybody that worked any kind of overtime. There's also the census sheet that has to be completed every single day and posted and turned in. And then the floor plans are created by the staffing coordinator as well. So they create the actual floor plan that we put in our book. And that's what goes on our whiteboard for the day.
Now, is this going to be a full-time position?
Yes.
Yes, it is.
So currently, this one person does 3 different jobs?
Currently, yes. It was by her choice. And
I
like
guess
I said,
I guess I don't understand how we're going from 1 position to 3.
I can't honestly tell you the history of why she decided to take on all 3 positions. Maybe Carla, you can enlighten
But I mean, if she gets it done and she works full-time, and then we're gonna make it 3 different positions?
Well, and I'm assisting right now. I've been helping with the schedule for probably 3 months,
Right,
going on 3 months now, because
Right.
she's not there every single day.
right.
So, and then when she's on transfers, then somebody has to handle, that's the other thing, when she's not in the building, then that falls back on the nursing staff to have to handle the call-offs, mandation, phone calls, do the fan out. So, and that's been happening quite a bit, because she is transferring people with her limited time that she's there.
In the third position is,
The actual position, her title of psychosocial coordinator, so that was already filled. And then the part-time driver, we're gonna keep it part-time. And then we need a scheduler and then that's why I said we have her or him up front and be a receptionist / scheduler so that she or he could answer phones and whatnot.
So how many hours will it be with the 3 positions then?
The psychosocial coordinator is full-time. And then, up to, I think we agreed 30 hours for part-time driver when it's needed. And there'll be a full-time position for the scheduler / receptionist.
Wow.
And it'll work.
Debbie, you had a question too.
So do you have someone in-house in mind for this?
For which one?
For this, for the staffing coordinator position? Or you'd have to interview?
We'd have to interview,
Bring
absolutely.
someone in?
Mhm. It'd be a non-union position. The psychosocial coordinator was union, and then the part-time driver and the scheduler are non-union.
Bill?
And this has already been through the money people?
It was, and like I said, there was a lot of, there was just a lot of, I don't know how I'm gonna categorize that. But I just felt it necessary because of the outcome of the other meeting that we have this again today and bring it up again, and that's why I had Carla here.
So we're gonna vote on this today,
And if it can move forward again, absolutely.
and then it's gotta go to the money people
Sure,
again?
absolutely, and Carla will be right there with me all over again.
Salary and labor, not money.
Well, right, I knew what he meant.
Who is it?
Salary and labor, not just money people.
Yeah.
Not the number. That's fine.
The money people.
I knew what he meant.
So can we put it to a vote, or?
Well, we want to make sure everybody's questions are answered, and then we will.
Absolutely.
I have one more. So you're going from 40 hours a week to 110?
If that's what it breaks down to, yes.
That's a big difference.
It is.
How many hours on the driver?
Maximum of 30.
Okay.
Because she said there's
Okay,
2
got it,
full-time
yes.
positions and 30 hours, so it'd be going from 40 hours to 110.
Correct. And like I explained, I have money in the budget from last year from a previous position that we do not need, that is still there, that will compensate for the scheduler receptionist position. And then the psychosocial coordinator that was hired in-house, because it's a union position, is starting at a lower rate than what the person is that's been there for 33 years.
And just to clarify too, so the staffing coordinator position, before this person absorbed it, it was a full-time position. It was already established, and when that person left, it was offered. She took it, got a little bit extra money, and she absorbed that job. Which, nobody wants to do that. No, I don't know why she would want to do that, but she did, and we're very grateful for it. But that definitely is a job that not everybody's gonna be able to do as succinctly and as well as she has. But again, I want to reiterate, I help with the schedule. I'm doing some of that work right now with my job. So I'm absorbing some of that right now currently.
Doug, did you have something?
Yeah.
Quick comment. Just because it's in your budget this year, you're moving forward to next year, and it's going to be an increase in the budget due to that.
Absolutely.
added hours.
Yes.
So it doesn't make any difference if the money is sitting in the budget right now.
And I have my budget about 95% done with this new position in there, which obviously I'm not turning in my budget until I know what's been approved and not approved. And yes, it's still financially viable. And that's one of the reasons that I have attached all those bar charts, because I want people to recognize when I say, yes, it's viable, those charts prove it. And then we're gonna increase the census up to 65, and then by the end of the year, in all honesty, we're looking at 70, which will be our max. So if you want me to forecast that, I can do that. I can show you viably how we can do all this.
Has everybody seen the bar charts?
Well, we just got them today, so I don't think
them,
we've
yeah.
really had
Right.
a chance to study them.
That's right.
Yeah.
So how can you make a decision if you haven't seen the bar charts and got any questions to be answered?
Did you have something, Doug?
Yeah, looking at the job description for the staffing coordinator, slash receptionist. Starting at the salary, you had $20.50 an hour. How did you arrive at that?
I have, honestly, I don't know. I don't know why it's there.
Is that a union position or non-union?
No, she was a union employee, but that's when it had already been talked about and discussed that we changed, the psychosocial coordinator was going to continue to be a union position, and then the scheduler and the part-time driver were going to be non-union, and it was approved through the attorneys and Summer. So that's probably the old salary from a union position.
So do you have an update on what the salary position would be?
Not until I know where we're going with this.
I mean, for finance to look at this, they would probably be interested in your recommendation as far as
I know.
what your salary range would be. So, and then the responsibilities, I read through each one of them. Those responsibilities are scheduling responsibilities, not receptionist responsibilities. Do you have any receptionist?
Not yet. It was
Responsibilities.
something that I discussed with someone, and that's when we decided that we would put it that way, because I can make some more internal moves for people, and that way have an additional person that can answer the phone. Because right now, I have someone that works in medical with all the charting, and she has to file everything. That's her job. Her job is medical records. She's up in the main office right now. She is a fallback to answer phones. The other person that answers the phone also does all the inventory throughout the whole entire warehouse constantly, and also has to take all inventory and put it where it belongs when it's short. When neither one of those two are in the office, then it falls on the HR person. I need more structure in that.
So you envision this person to be answering the phone and also maybe
this
doing some
person-
inventory?
Yes, no.
No, okay.
What the medical record person is going to go down onto the nursing home side, because honestly, that's where she belongs. So there's already one extra person not answering the phone. The person that does all the inventory and the restocking will then technically just move over a little bit, but she'll still be the fallback for answering the phone. And then the scheduler / phone call answerer will then be right there. That way she's right there, or he is right there. It makes sense when you go there, when you are in the building.
Okay. And then, and then the bottom part, the education and work experience requirements. Those seem like those would be for a receptionist and not for your scheduler.
Well, then we'll
I
have
would
to
expect your
change it.
scheduler would require more than just a high school diploma.
Why is that,
I'm asking. That's a question.
Carla?
I don't know, I haven't seen that. job
Higher than a high
description.
school education.
I mean, you don't really have to have a lot of, it's not like a managerial role. The big thing with it would be organizational skills, making sure, you know, that there's someone that can keep all of the books together, because there's like 5 different books they have to go through every day. So I think it could be an entry-level person, because we would be able to train them. I'm sure I'm gonna be the person that's training, because the person that's retiring is leaving in 2 weeks.
2 weeks, right.
So that's, again, gonna fall on me to do that training.
So thinking of your job when you were a scheduler, you already had a 2-year degree.
I did.
So versus a high school degree. So I would think at least a 2-year degree would be something that you'd be interested
I
in.
think I just took it on because I was asked to do it as a floor nurse. And so I did it along with my floor nurse. And then eventually it just became, that was like the main job I did, plus, you know, doctors. It turned into, we do a lot of different jobs in the nursing home. We assign different things to different people. But I know at one point in time, we had, it was the very first staffing coordinator we had, she was a CNA. She was a CNA who worked the floor for several years. I don't think it would hurt to have that kind of background, but I don't think it's necessary, because you're not working the floor. You're essentially just making sure that it's staffed.
So for someone that, this is one of the first job descriptions I've seen, the education and work experience requirement, are those minimums
Yes.
versus what you would like to have or see in the position?
I could interview a person that does not have any sort of degree, and they may be wonderful. I cannot judge by their educational factor, because the more education you have, obviously the higher position you're going to look for and qualify for.
Being a college teacher for a major part of my life, I would like to see a little bit higher requirement on that position, that's all.
Being a PhD candidate, I would too, but it doesn't mean it's going to happen.
Well, if you set your sights too low, that's one thing.
That's
You
a-
set
that-
your sights
Right, but
where
I didn't make
where
that.
it's actually the person that you want, that's something else.
Then that's a county thing to change, not mine.
So I'm just trying to think of some different things that the finance, the salary and labor people might question you on. I'm not saying I'm right, I'm not saying you're right.
One thing I would add to that is the higher the education level, the higher the rate of pay.
Absolutely.
And so, and then the proportion, receptionist versus scheduler, what do you envision that to be as far as the time spent on a monthly basis?
On a monthly basis?
Yeah.
I don't know, they'd have to
I
answer
would-
the phone every day.
I would say for sure, daily, their main focus is always going to be the schedule in the morning when they come in. Because that's, right now, again, we have somebody else doing part of the staffing job, checking the mandation log and updating the mandation log and checking the schedules. Because those floor plans have to be kept for 7 years. We have to keep those in separate binders and keep those for logs. So that's one of the first thing they would do, is come in the morning and check the staffing levels, make sure the board is, so I would say it's gonna be like throughout the day, probably 50-50.
Right.
5 hours doing the schedule and, you know, maybe like, you know, I would say probably 5 hours and 3 hours. I mean, but again, every day is different. Every day is different.
Right.
Depending
And
upon the day of the week, yeah.
And it doesn't take long to pick up the phone, answer it, and direct it to where it needs to go. It's not like they have long, detailed conversations. They're literally answering the phone so then they can transfer it to whichever department and/or person they're looking for.
And our current staffing coordinator, she actually has like a little whiteboard outside of her office, that she will put like her open office hours. Like, so if a resident, or if a staff member has like a question about their schedule, or wants to put in a request for something, she has a mailbox that they can throw that in, but if they want to speak to her about something, she puts open times, like when she's available, you know, and we could do that in this case too, and just say, hey, these are gonna be the times that I can sit and go through schedule stuff because I'm also doing, reception, so.
What do you envision if she does find, you're talking maybe 5 hours a day, and then answering the phone, if she finds herself with open time, do you have like perhaps clerical work or other
Oh,
things
sure.
that?
Oh,
Yeah, I mean,
we
there's
both
always-
do.
There's
Yeah.
always something that can be done. A lot of times too, if there's, downtime to maybe go on a transfer, let's say maybe we need a chaperone. Everybody should be able to kind of pitch in and do those things as needed. We could always use extra hands in every area of the building, really.
Sorry, I didn't mean to interrupt you. You were done? Okay. Anybody else have anything? Bill, I better check with you. Nothing? You got nothing to say? Don, did you have anything else to add to us?
No, thank you.
So,
Motion to send it back to salary and labor.
yeah, okay, so do we have a motion to send it back then to salary and labor? And also, I guess, do we need to clarify, or do we want to let salary and labor clarify what an hourly rate might be? Or give salary and labor that, maybe they would do a range?
I can also come with something. In all honesty, with everything that I do on a daily basis, this is just something that I can figure out. I just need to know that if I take the time to figure it out, that it's going to be worth it.
And one other question that I keep forgetting to ask. So we have 2 weeks before this other person leaves. What is the plan and the in-between plan?
Carla, and that's one
That's
of the reasons of
not
why
good.
this is so important, because on top of everything that she does every single day, she's now going to have to take that over.
And we're in our survey window.
Right,
So
exactly.
that's.
That's going to
we're
be tough.
trying to
What
go
does that
to
mean, your survey window?
Illinois
I'm sorry.
Department of Public Health, our annual survey for relationship we are in our window right now.
Yeah.
Okay, so they're looking at you close.
Yeah, our window opens at May, and so we've just been waiting for them to come. They will be there for 4 to 5 days, and they scrutinize every inch of that place and every file and every person.
And you don't know when they might come?
No, it's just
They
whenever they
pop in.
come, whenever they come, we're all there. But when you put that then on top of the fact that we have a person that's leaving, and then we don't have a scheduler, this now falls on Carla, on top of everything else that she's gonna have to do. And when the state comes, like I did last year, state showed up at the building, I had to leave here. Because
Remember
they
that, yeah.
expect that.
Yeah,
They don't take no for an answer.
right.
So we have no choice. We have to drop everything we're doing because state is in the building. That's it.
Bill?
Do have a question. All right. To me, it sounds like this position is very necessary that we fill it. But can we vote on that now as a committee to fulfill this position? Or do we have to wait until it comes back from, the money people? What is it? Labor?
Salary and labor.
Salary and labor, yeah.
If you guys are forwarding salary and labor, if they can come up with the salary and agree with the
So
And
we,
at that point then, does it go to the full board or it just is good to go?
salary and labor.
Okay,
They say yes,
okay,
good to go.
Yeah.
okay,
The final decision would be made in salary and labor
okay, thank
for
you.
the pay and the
And
concept.
yes or no on the position, correct?
well then, I make a motion that we vote on this, it's one position we're voting on, right?
Absolutely.
Okay, so you want to make a
I make a
motion?
motion that
to
we
forward to
vote to
salary and
have a
labor.
scheduler.
Okay. Forward to salary and labor, the schedule position
Thank you.
for the nursing home. Okay, anybody want a second?
I guess I just don't understand why you're going from 40 hours to 110. That just seems excessive. Does anybody else feel that way, or?
Well, we had to fill the psychosocial coordinator, so there's 80 right there. Full-time job. Or 40, sorry, full-time job. So, and like I said,
what the person that's retiring was making there's a huge gap between what the contract states that we started this other person in, because we posted it at work just the way we're supposed to, and it went through, and so we chose, obviously, another union member, so, but according to the contract is what they started at, which is huge difference. And then the part-time driver is up to 30 hours. There's times that, I mean, in a week, depending on transports, it could only be like 10 hours. Because it's not a given. That's why it's part-time. The longest transportations are usually either to Rockford or Peoria, and that would be like 6 hours in a day. Other than that, she may only have maybe 1 or 2 more that's just gonna run around Ottawa. Then you're talking, if you take the long trip out of it, you could maybe see like 10 hours a week. So I would prefer if you could find like the mean of those extensive, from lower to higher, and maybe throw that in there. But like Carla said, the scheduler, it used to be there. It used to be there. So is it a benefit to have it back? Yes, absolutely.
It just seems excessive, just for doing that,
Have you done staffing before?
Yeah.
In facilities?
Yep.
So, in a healthcare facility?
Yes.
Okay, so, on average, what did you spend on doing the staffing daily?
Really? I mean, you're right, you have people call off, and it is a pain, but there's no way it's 40 hours a week.
Yeah, we do, I mean, it's a valid position that we had before that took on that role. And it is, like I said, every day that schedule changes. And then
Right.
every single day, you're trying to find coverage for those parts that are missing. Also, we also have contracts with nurses, and we use contract agency. Not a lot for CNAs, because we're pretty full with CNAs. The conversations you have to do email back and forth, follow up. So there's always something that's coming into that day, that's taking up that day for that scheduler. I mean, it is, if I asked her today, what do you spend on the schedule? She's gonna tell me at least a good 5 to 6 hours a day on the schedule. Getting her floor plans done, getting her mandation done, getting her census done. And some days it might be less. Some days it may be less. Some days it may not be as much. But it's still, to me, a full-time job, from start to finish, month to month, getting those things done. I did it, and I did do a couple extra things. I did do doctor's visits, but that wasn't every day. That was maybe once a week. So there was a couple little things that kind of filled up some of the other parts of the day. But for the most part, it was basically just working on the staffing coordination part of it.
So if the committee feels like a full-time job is excessive, what would be the potential of making this a part-time job? Would that be, I mean, rather than, it seems like most of us think that they don't want to approve this at all. Would that be something that we could all consider, perhaps?
So you'd be talking a part-time job at 6 hours a day, 5 to 6 hours a day. And then that's all that person would do. So I would not have the benefit of having someone else there that could also not only do scheduling, but to assist with answering the phones and/or where they would be positioned. We've got HR, we've got social, we've got finance, we've got myself. So this person, if they had any downtime, there's plenty. There's plenty to do. But if you want to just keep it just a scheduler and go part-time, then I will request 6 hours a day.
So how does everybody feel about that? Is that something that you might consider? It seems like, other than Bill, nobody wants to
Right.
go for the full-time. What do you think about a part-time? Would that be anything you'd consider?
Are you looking at part-time, no benefits? Would that help if I just make it a part-time position? And then we probably won't get anybody to do it.
So,
Don?
just a quick question. So, the person that's retiring did the scheduling and the driving. Is that
Yes,
correct?
so if something was to change with the scheduling, that's why she's got that mailbox in front of her office when the door was closed. So if somebody wanted to take a day off, they would just drop it in there. So then as soon as she got back, she'd have to go into the schedule again and change everything.
Yeah.
Yes, yes.
So the job is changing from a 40 hours to 70 hours, potential 70 hours. That's what it's doing. That one job that the person retired from is changing from 40 to 70.
No, she said there was 110 hours total.
But that's the other one, the psychosocial.
The driver, yeah, the psychosocial coordinator is 40 hours a week. That's in the contract.
Yep.
Then we could change the scheduler down to part-time, no benefits, 6 hours a day max. You want to do it that way. And then we have the driver who's part-time, and that could be anywhere from 10 hours a week to 30, the max. The max, we did cap it at 30. And that's only if they need to go to Rockford or Peoria for a transport, because that's obviously a whole day. That's where we're at with numbers.
Does anybody have any comment on that? Is anybody interested in a motion for a part-time position, 6 hours a day? With no benefits? Bill?
I don't think a 6-hour part-time job is, I don't think you're gonna get a good quality person in for that.
Okay. And so if we don't go with this position, what happens? Who does it? What do we do? What do you suggest they do?
Thank you. I like that question. What do you guys suggest we do if we don't have a scheduler?
If you had,
Second or no? So like either
Yeah, we don't.
motion dies and motion carries.
okay.
Then you guys can have further discussion of what you want to do.
Okay, so Bill has a motion to forward the scheduler position to salary and labor. Does anybody want to second that? And then we can move on.
I'll second it so I can discuss it. So,
Okay, all in favor?
it would be.
Sorry, I'm sorry.
Yeah, go ahead, go
Yeah.
ahead.
All in favor of that?
Aye.
Okay. Comments?
So, go ahead, go ahead. That was a vote to send it to salary and labor.
Okay, so we just wanted the second and then the discussion, is that correct?
I wanted to second so that we can discuss it.
Okay,
Right, we are discussing.
yeah.
Just
So
to
do we want to
discuss it.
recall the approval of that? Yes, okay. All right, and now Doug, what your questions were?
You have a discussion before the vote.
Yeah, you're right,
Yes.
my mistake, but we just recalled it,
Yes.
yes.
Okay.
Sorry.
No, I'm just going back to why it went to salary and labor, and then why did salary and labor send this back to this committee?
Because,
They denied it and then.
It was denied, and based upon the discussion that salary and labor had, why was it denied?
because there is confusion on the necessity of the position.
We had very little information on that, which is why Carla came to explain it more to us today. And thank you, Carla, because that did really clarify a lot, because for me, I don't understand all the, all that is involved, other than just saying, here's the schedule, oh, you want to change it, okay, we'll plug this one in. I didn't
Sure,
realize there's a
no.
lot
And
more
I
involved.
don't ever have any, qualms about answering any questions from the nursing home committee. I think the more informed you are, the better for us. So I'm trying to advocate for my facility so that we are whole and that we do things the right way, because that's what we're known for, and I want to keep that going. In order to do that, I have to have people in place to
Right.
assist me in those areas.
Right. It is
So,
hard to wrap your
yeah.
mind around how somebody could be doing 3 jobs and suddenly we need
Well,
3
and I'll be
people to
honest,
do
it
it.
probably shouldn't have been done, and I had nothing to do with that. The psychosocial is not my department, so when that was brought about, because we're losing that staffing coordinator, I think at the time, the powers that be just thought it'd be easier just to hack that job into somebody else, maybe to avoid this kind of situation, and so that's what happened. But I don't agree with it. I think having one person do multiple jobs is a burden placed on somebody, and I don't think it was fair, and I don't think we should do that going forward. I think it needs to be a job for one person to do, with maybe miscellaneous things. We all do miscellaneous things, so.
Hang on, Bill, I think Doug's not finished. Or are you finished?
So what does salary and labor see? They see this, the job description, and that's it? Plus having people come to support.
I'm not sure I don't even recall seeing that, but maybe it's just me.
I mean, if that's the, so, what salary and labor see? Do they see the job description?
Yeah, they will.
And
They
then,
will. I think I was
Or
involved in
did.
that meeting.
I'm assuming they did, yeah.
and do you recall why they denied it, or did they give a reason?
Because of the confusion. Basically, in all honesty, it came down to just that. As far as I'm concerned, there was so much confusion on the position that people didn't understand what it really involved. That's what I took away from it. I could be.
But I just don't understand why it takes full time to do, because I've done it before. And I don't understand why it would be that much. And yes, it's a pain, and yes, I got calls in the middle of the night all the time, even on scheduling, which wasn't fun. But, you know, if somebody called off or something, but it did not take that long. I just don't understand how it goes from a 40-hour to a 110-hour change.
So, in the salary and labor meeting, it was stated that it had been being done by the DON.
No, they said that the DON should be doing it.
Right.
Should be doing it.
Should.
Yes, yes, the comment was made that the DON always does the staff coordinating, the scheduling. But no, I have not been doing it. Prior to 2019, which is when I took over, there was a staffing coordinator position. That was the person that did the staffing coordinating, for us. And then, when that person left, then that job was absorbed by the psychosocial.
So, maybe it's just me, but I'm wondering, what does the psychosocial coordinator do that is a full-time job? What are the job duties on that? Why was there enough time for that person to then do these other jobs?
I can't answer that for, I can't answer that for the person that decided to take all 3 of these positions. I can't. I could ask her to come, but she'll be retired in 2 weeks.
Yeah.
So,
Just
and
the
it was
thing
years.
I'm wondering,
I mean,
because to me, it seems like that would be the job, and I don't know, but that would be the job that's like, what all do you do? You don't know what she does?
I do know what she does. I don't know why she took on all 3 roles, because I wasn't there.
Is the social coordinator, is that who does like all your, your
She-
parties and things like
No,
that?
the
or-
psychosocial coordinator, she has to schedule all the transportation. She has to talk to doctors all the time. She helps the psychosocial person do interviews. Interviews have to be done every day with the residents for the MDS reports, so that Medicare and Medicaid know that, everyone's being taken care of and that all their needs are being met. That's the biggest thing. We have 62 residents.
So they have to visit each person every day and say.
They have
"Is
to
everything
they
good with
break
you?"
it up. So say you have 62 residents and you've got 5 days a week to do it. You're gonna mathematically break it up so you can visit these people. In the process of all that, then you've got to do inventory of all the false teeth, the hearing aids, the glasses, anything that they have that then they may lose, then they have to go and they have to either figure out what happened to them, so it takes a little bit of investigation, and then they have to contact the family. So it's a lot of, it's ensuring that the residents are being taken care of with their own personal stuff, which is very important. It sounds minimalistic, maybe, I don't know. But if you're gonna go into a nursing home and all you have left is just what you can bring with you, so it makes it very important that we need to ensure that there's someone checking on these people all the time. And if they lose something, it's heartbreaking to them, no matter what it is. And so that psychosocial coordinator works with psychosocial in order to ensure that these people are happy every day. So does that include making and we're not just talking medical, we're talking ear, we're talking eye, we're talking anywhere one of those people need to go, she has to set those appointments up. And then all of a sudden, that person may change their mind. Then they have to call and they have to reschedule. Or they have to set up transportation and they have to make sure that they're on time. There's so much. Residents just don't check into a nursing home and that's it. We literally live and breathe 24 hours a day. So yes, does it take all those departments and all those people to ensure that these people are happy and that the families are happy and that the community's happy? So does she do a lot of little stuff 8 hours a day? Sure.
Okay.
May it
Just-
sound
yeah,
unimportant to
just-
somebody? Maybe, but we need it.
Yeah. When you title it psychosocial, it's hard to know what's involved in that job description, so.
Yeah, it's just
Helpful to
making
know.
sure the residents' needs are met. They used to do groups, like little groups, like a men's group, like a reading club thing, making sure that, meals, if meals are an issue, like appetites, making sure that they have their likes and dislikes pointed out, the little things, like when somebody comes in to kind of capture them, what they're about.
And that's every day.
Okay,
And that's what makes families happy,
okay.
because their loved ones are happy. Yes.
Go ahead, Ron.
I called to vote for Anna roll call.
Okay. And that was, I'm sorry, just give me a moment here. So
And a
we're gonna
motion to
roll call
forward.
vote on the motion to forward to salary and labor, correct? And that was Bill's motion was as a full-time position. Okay, all right. We shall do that. Kathy? Yeah, Doug seconded. Aye. Okay, Doug?
Aye.
Matt?
Nay.
Ron?
Nay.
Bill?
Hi.
Nancy?
Nay.
Oh, no. You're it. I'm sorry, I'm gonna say aye also. I guess I'm sorry to three of you and not to the other three. So motion carries and forward to salary and labor. Thank goodness I'm not the chairman on that. I know it's not. I do. Oh, you do? Yes. John, sorry.
I'm sorry, I have to apologize, I had to go out for a call, but did you discuss the item on project agreement for the patio addition?
We did, yes. And we voted to go out for bid on that.
Okay, just so everybody understands, that's estimated $250,000 patio.
$255,000.
Pardon?
$255,000.
Yep.
Yep. Correct.
Okay, and we are not ready, I think we are down to the budget.
And
That's
no.
the next item. And we don't have that.
So, I do have it, but I needed, like
We're
I
not ready
said,
yet.
I had to find out where all that was going first.
Okay. Is there anything else? Does anybody have anything else to bring up or discuss? Okay. Do we have a motion to adjourn? Doug and Bill? All in favor? Aye. All right, meeting is adjourned.